Last time on No Match MDs, I talked about the impending doctor shortage over the next decade. Too many medical students, yet not enough residency slots. Impending doctor shortage, yet discarding fully educated doctor grads. Why isn't the solution to this dilemma a slam dunk? Because nothing is ever that simple. There are the politics involved that complicate the solution to this deficit. Is there really going to be a physician shortage? Or are the VA, the Affordable Care Act, and some states planning to utilize less expensive physician assistants and nurse practitioners to administer health care? Joanne Page of the Cleveland Clinic said, PAs generally make about half a physician's salary or less, depending on specialty. An ER doctor makes an average of $270,000, and an emergency room PA makes an average of $112,000 per year. And several states, such as Arizona, Maine, Maryland, Nevada, Vermont, and Washington, have liberalized laws to enable nurse practitioners and PAs to perform some treatment normally done by doctors. The Affordable Care Act has allowed millions more insured patients with a shortfall of sufficient doctors to treat them. Compared to other countries, the U.S. has 2.5 practicing physicians per 1,000 people versus 3.2 physicians per 1,000 for an average of 34 other countries. Is a PA or a nurse practitioner qualified to see patients as effectively as a doctor? A PA curriculum typically requires 1 year of classroom learning and 1 year clinical work. A nurse practitioner requires a 1 to 3 year program postgraduate after obtaining a nursing degree. Doctor training requires a minimum of 7 years after college. The 3 doctors in my family had 7 years, 10 years, and 11 years of post-college training. The further depths of knowledge and medical experience afford a doctor a level of synthesis not attainable with lesser years of study. A dermatologist I know recommended that a patient obtain a consult regarding a skin ailment, sometimes associated with pancreatic cancer. The patient returned to thank the doctor for the early diagnosis of pancreatic cancer, which might have been missed under normal circumstances. Would a PA have known that correlation? An OBGYN doctor told a patient to obtain further diagnostics for continued lactation after cessation of breastfeeding. There's an association with pituitary tumors with uncharacteristic lactation. The patient did up having a pituitary tumor. Would this have been noticed by a PA? Often a doctor never enters the room when a PA is seeing a patient. Ironically, PAs, who by definition are supervised by a doctor, are allowed to work immediately after graduation. A doctor with 4 years of medical school cannot work at all until obtaining a license upon completion of a residency. They can't even work as a PA due to the stringent PA licensure rules. There's something wrong with this picture. Please share this blog with your colleagues and legislators.